Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about cataracts, a disorder that attacks the eyes and affects your vision. They are very common as you get older. In fact, more than half of all Americans age 80 or older either have cataracts or have had surgery to get rid of cataracts. You might not become aware that you have a cataract at first. However, when cataracts progress, your eyesight may become blurry, hazy, or less colorful. You could find it difficult to read or perform other daily tasks. Keep watching to support a friend or family member whom you believe should get checked out because they exhibit many of the symptoms mentioned in the video. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Now let's go to the video. Millions of individuals worldwide suffer from cataracts, a common eye illness that can impair vision and, in the worst-case scenario, cause blindness if left untreated. They develop when the natural lens of the eye gets clouded, making it difficult to see clearly and perform daily tasks like reading, driving, and recognizing faces. Even though cataracts are typically linked to aging, people of all ages can get them. This video provides a thorough explanation of cataracts, a common ailment, by examining their causes, symptoms, treatments, and prevention. What are cataracts? When proteins in the lens of the eye start to group together, hazy regions form that prevent light from reaching the retina via the lens. This is how cataracts arise. The layer at the back of the eye that is sensitive to light and sends visual information to the brain is called the retina. As cataracts worsen, they can impair a person's vision significantly and negatively affect their quality of life. There are several types of cataracts, including nuclear cataracts. These develop in the lens's core and are most frequently linked to aging. They may result in the lens hardening and turning yellow, which would impair vision at a distance. Cortical cataracts. These begin as wedge-shaped, white opacities or streaks on the lens cortex's periphery. They progressively advance toward the center, producing glare and contrast issues. Posterior subcapsular cataracts. These develop behind the lens and frequently advance faster than other varieties. They may result in glare, light halo effects, and trouble reading. Congenital cataracts. These cataracts can be brought on by genetics, infections, or pregnancy-related trauma. They can also develop during childhood. Causes and risk factors. Although aging is the main cause of cataracts, a number of other factors can also play a role in their development, such as genetics. The chance of having cataracts rises with a family history of the condition. Diabetes. Because high blood sugar affects the lens, people with diabetes are more likely to develop cataracts. Ultraviolet, UV, radiation. Extended sun exposure can cause damage to the proteins in the lens, raising the possibility of cataract development. Smoking. The production of toxic compounds from tobacco smoke can hasten the development of cataracts. Alcohol consumption. Drinking too much alcohol has been connected to a higher risk of cataract development. Eye injuries. Eye trauma can hasten the development of cataracts. Medications. Long-term use of some drugs, like corticosteroids, can raise the risk of cataract development. Radiation therapy. Radiation exposure, such as those obtained from cancer therapies, might hasten the development of cataracts. Symptoms of cataracts. Early indications of cataracts may go undetected because they frequently develop slowly. As the illness worsens, typical symptoms consist of blurred vision, a progressive loss of sharpness and clarity of eyesight. Fading colors. Colors seem less vivid or duller. Glare and halos, usually accompanied with glare, sensitivity to intense lights and headlights. Difficulty seeing at night, diminished vision throughout the night or in dim light. Double vision, seeing double images, especially in one eye. Frequent prescription changes, needing frequent updates to eyeglasses or contact lens prescriptions. Sensitivity to light, increased discomfort or squinting in bright sunlight or artificial light. Diagnosing cataracts. An optometrist or ophthalmologist will perform a thorough examination of the eyes to identify cataracts. Among the things the examination might look at are visual acuity test, evaluates your ability to read letters on an eye chart at different distances. Slit lamp examination, This method involves using a specialized microscope to look at the lens and other structures in the front of the eye. Retinal exam, dilating the pupils and looking for abnormalities or symptoms of injury to the optic nerve and retina. Tonometry, assessing intraocular pressure to rule out glaucoma. Treatment options. Surgery is the most effective treatment for severe cataracts, although early-stage cataracts can generally be treated with prescription glasses or contact lenses. The clouded lens is removed during cataract surgery and is replaced with an artificial intraocular lens, IOL. Cataract surgery is primarily performed in two ways. Phacoemulsification, the most popular surgical method, in which the clouded lens is broken up with ultrasonic waves so that it can be removed with a little incision. Next, the IOL is placed in its location. Extracapsular cataract extraction, ECCE, involves making a wider incision to install the IOL after the clouded lens is removed in one piece. Very advanced cataracts are usually treated using this less common technique. With a high success rate, cataract surgery is typically safe and successful. After the surgery, most patients report having better vision a few days to weeks later. Advances in cataract surgery. Recent developments in cataract surgery have given patients more options and better results. Among these developments are laser-assisted cataract surgery. This method improves the accuracy and safety of the surgery by softening the cataract using precise incisions made with femtosecond lasers. Premium intraocular lenses. Following surgery, patients can now select sophisticated IOLs that reduce the need for glasses by correcting for astigmatism, presbyopia, or enhancing depth of focus. Microincision surgery. Procedures that make smaller incisions have the potential to heal more quickly and with a lower chance of problems. Recovery and postoperative care. Following cataract surgery, patients are usually recommended to refrain from pushing or rubbing your eyes. When you sleep, cover your eyes with a shield. Use the recommended eye drops to lessen irritation and stop infection. For many weeks, abstain from intense activities and heavy lifting. Attend follow-up consultations to track your recovery and discuss any issues. Preventing cataracts. Even though age and heredity are uncontrollable risk factors for cataracts, there are several lifestyle modifications that can help lower the risk of cataract development. Put on sunglasses. Wear sunglasses that completely filter UVA and UVB rays to shield your eyes from UV radiation. Quit smoking. Reducing your exposure to tobacco smoke can help you prevent cataracts and maintain better overall eye health. Maintain a healthy diet. Eating a diet high in omega-3 fatty acids and antioxidants, like vitamin C and E, can help maintain eye health and lower the chance of cataracts. Control diabetes. People with diabetes may be able to avoid developing cataracts by maintaining blood sugar levels below normal. Limit alcohol consumption. Cutting less on alcohol can improve general health and lower the chance of cataracts. Frequent eye exams. Early cataract detection and prompt treatments are made possible by routine eye exams. Cataracts in different populations. All ages can be affected by cataracts, although some populations may have particular difficulties and needs to be taken into account. Children, early intervention may be necessary to prevent visual impairment due to congenital cataracts. For the best possible visual development, prompt diagnosis and treatment are essential. Adults with diabetes. Controlling blood sugar levels and scheduling routine eye exams are critical for both preventing and keeping an eye out for cataract development in people with diabetes. Elderly. Surgery can greatly enhance an older adult's quality of life by restoring their eyesight and independence. Cataracts are more common in this age group. The impact of cataracts on quality of life. A person's capacity to carry out daily tasks and participate in social interactions can be significantly impacted by cataracts, which can also have a negative effect on their quality of life. Cataract-related vision loss can result in diminished independence. A person's capacity to live freely may be hampered by difficulties with activities like driving, reading, and recognizing faces. Increased risk of falls. Vision impairments, especially in older persons, might raise the risk of falls and accidents. Emotional and social challenges. Feelings of loneliness, melancholy, and worry might result from vision loss. Timely detection and treatment of cataracts can help restore eyesight and enhance general health. Cataracts and technology. Technological developments keep improving cataract diagnosis and treatment. Digital imaging. State-of-the-art imaging methods provide more precise cataract assessment and tracking. Telemedicine. Platforms for telemedicine can help patients in faraway locations by offering remote consultations and support. Artificial intelligence. AI algorithms can help design surgical procedures and diagnose cataracts, leading to better and more efficient results. Future directions in cataract research. Research is still being done to better understand, prevent, and treat cataracts. Gene therapy. Looking at how gene therapy might be used to treat the hereditary causes of cataracts. Pharmacological interventions. Investigating drugs that could stop cataract development or slow down the disease's progression. Biocompatible lenses. Creating cutting-edge IOLs that replicate the human lens and offer better vision correction. A common and treatable disorder that can greatly impair vision and quality of life is cataracts. For cataracts to be effectively managed, it is essential to comprehend the causes, symptoms, and available treatments. Future research and surgical method advancements could lead to even more successful ways to restore vision and enhance the lives of people with cataracts. A healthy lifestyle, frequent checkups, and prompt medical attention can all help people lower their risk of cataract development and maintain clear vision for many years to come. We get closer to a future in which preventable blindness is a thing of the past as we continue to expand our knowledge of cataracts and create novel treatments. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.